Cindy, a question that just came in is, what is the turnaround time for surgical templates?
It's about 5 to 7 business days.
Another question that just came in is if you offer surgical templates that can be used with pilot drills and final drills.
Yes, that's a great question. So our surgical guides, we can design around any type of template. So whether it's just for a pilot drill or just for a final drill, or you want either a pilot or a final, we can do that. Also, any type of system that you're using, whether it's the Zimmer or 3i, the Navigator, any of those type of systems, we can design the surgical guide to fit those. So you don't need to buy more instrumentation. You can use what you have in your office, and we design it on that. If you do need instrumentation, we can help provide that for you as well. So whatever your clinical needs are, we design the surgical guide around that.
Look, I'd also like to point out that the software could be used with all implant systems, and surgical guides could be manufactured for all implant systems. Cindy, another question that just came in is if you could give some indication regarding pricing of surgical guides.
Sure. The surgical guide is a flat rate. It's $375, and that's any number of implant, and that's any style of surgical guide, whether it's bone-supported, tissue-supported, or dentition-supported. And that also includes the software support. You get surgical and restorative comprehensive reports. So that includes the entire process. Also training of any CT staff and training for radiographic guide fabrication as well. So.
And to address another question that just came in, the guides control the angulation, the location, and the depth. So depth control, depending on the drill system, the depth control is controlled in the surgical templates as well. And yes, the guides are compatible with all implant systems, including BioHorizons implant systems.
Yeah, and the drilling depths we can set. We have flexibility as far as the anatomy allows us to set the drilling depths to a certain height. And so if you do have guided surgery drills that have stops on them, we can set the surgical guide to that height so you bottom out. If not, what we do is we set the guides to seat as low, the drilling depth to be as low as possible, and then we'll provide those depths for you. So you'll either know exactly how many millimeters you have to drill down from the top of the guide to the bottom of the osteotomy, or we'll design it around your existing drill kit.
Cindy, a question just came in regarding slice thickness. What's the ideal slice thickness that should be requested from the scan center?
So the slice thickness, the scan center, what they do is they provide, when they give you the DICOM, that's the entire scan. And then you do the slice thickness on your computer in the software. And the standard is a 1 millimeter thick cut slice. So it's not something that you have to request from a scan center, but as we're treatment planning, if we're looking at 1 millimeter, sometimes we'll switch over to 0.5 millimeter or 2 millimeters, depending on the anatomy that we're looking at. So as far as the slicing and looking at the anatomy and going through the DICOM, we have the flexibility to be able to look at it in any dimension that we want to. So it's not left up to the scan site what they provide you.
Okay, I think that pretty much wraps things up. I want to thank Cindy for this informative and wonderful presentation. If there's any additional questions, Cindy could be contacted at info@informationdental.com and the phone number that appears on the screen.